Tell you.
It's a new month and we all yearn to be successful. But most of the things that flounder our success is bad health. Today I brought you the Prac Master when it comes to bones. Because most of you ask yourselves that, why is it that I always get the back pain? Today your questions are going to be answered. And sir, how are you?
I'm fine, sir. How are you?
I'm okay, sir. Pleasure meeting you, sir.
Nice meeting you too.
Okay, so most of the questions we've been having is how is a person supposed to sit? What is the sitting posture for a person? Could you kindly help us with that?
Okay. First and foremost, thank you for coming. Welcome to the Crop Master Fitness. My name is Kabagambe Agri and I'm the Crop Master. So, in regards to your question, we have basically the body anatomy. As you understand, we have the cervical area, we have the thoracic area, we have the lumbar area, and the legs down. Now, when it comes to sitting, most people are, or the most difficulties that I have found in people are the lumbar region and the thoracic area and a bit of the cervical area. Why? Because you find that people sit based on where they feel more comfort. Now, three things I'll talk about. People who work on computers for long hours. Either they are bending in like this and they are working without any exercise with their neck. That is affecting the cervical area. Other people are bent forward, maybe because they are trying to reach out to something. Like for example, people who do nails. You find that they bend a lot and so the pain is coming all the way from the chest backwards, especially the upper back. And then we have those that have lower back pain. So the pains are basically brought about by what we call disc herniations, or in Luganda, I learned in Luganda they call it amakumba kasisetuka. So you find that you sit in a posture that tends to be for a long time and then the disc slips and then it becomes a bulging disc or what they call a herniated disc. So those are the pains that people get, especially in the neck, chest, lower back. And those are the things that we are trying to help people to get rid of with our fitness kind of way of doing the work. Yes. So when it comes to sitting, let's backtrack the sitting. So if you are sitting, instead of the moment you have your feet straight, automatically your back curves in. And the moment you pull your legs and they go under the seat, it automatically makes the curve for the back. So if you ask me how someone should sit, if you're an office person, always ensure that the feet are going under, not straight. Because the moment they are straight like this, you curve in, like you have that curve. When they are back, you find that your posture just comes in automatically.
And you're straight.
Exactly.
Wow.
Now, for the phone, let me take, for example, this book was a phone. Most people are always like this. Now, I have a picture, if the person on the camera can show that picture up there. The angle at which one sits, you can see while you're holding a phone, you have 0 degrees, 30, 45, and 70. And each degree can convey a particular weight assumed. That if you're at 0 degrees, you have like at least a 5 kg weight on your body. If you're at 30 degrees, you have like 18 kgs you're lifting. If you're at 45, you have like 24 kgs seated on you. If you're at 70, 28 kgs, that's a lot of weight on an individual. So if someone would ask me, how should I hold my phone? The easiest way I can say, if you can see how I've just held myself, I have pivoted my elbow, and then I'm holding the phone at a position where I'm very comfortable. As opposed to when the hand is free, it's going down and I'm definitely bending and I will start to feel the pain. If it's a computer, kindly try to raise the monitor. Or if it's a laptop, you get a laptop raiser, let it be at the same position so that you don't bend it and you're always having a structure that is upright. So for me, that would be the most that I can say.
Wow. Thank you so much.
Ngera
wembagambye nti tugenda kubanga ebibuuzo byaffe byonna biddibwamu bigenda kuba biddibwamu omusajja ayogedde luzungu. I don't know how we are going to be helped, but I think asobola okuddamu n'abumenyaamenyamu ko katono mu Luganda lwakola ate lwasobola nga we kiri we are Abel Cuts on Brushes era nga tubaleetera abantu munnanga bagenda okutuddamu ebibuuzo byaffe era nga ku kamera kuliko Ejje Media abo wenyininyini musawo. What's the difference between you, the chiropractic, yeah, the prac master, wow, thank you, and the physiotherapist? What's the difference?
Okay, kati difference wano wejjira nti mu physiotherapy mostly according to my understanding, okay, sagala kose ebintu ebyabalala but according to my understanding, for example wofuna injury one nti if the bone is not yet put back in play, if one does not have the urge to put it, they will deal with the inflammation. Now for me, I come if the bone has moved in a particular angle, I'll hold it, press it back into the position, then the inflammation can automatically go, or you can still go for physio, and you do what? You get it aligned. Now, the physiotherapist and I can work together, and we can as well work separate. But what am I trying to say? I work from inside out.
From inside out.
Exactly.
Wow.
That is me in the Crop Master Fitness. I work inside out.
And to those ones?
Well, a therapist would be the best to answer that question because yenga specialist mwecho ajja kugamba nti nze nkola kino na kino naye kati nze nkuwulira nze ekyenkola, for example nti olina stiff neck okitegeera kati stiff neck wano ayinza kuba nti disk yombulako, say for example C4 C5 nti yatambula muko oba okweyita okusesetuka nze nenkola kino nzija nenjizaayo kati simanyi oba wafizi yajja kukozesa massage or something to relax the muscle for it to go back, but we are working kind of different
but giving same results.
Yeah.
Wow, that's really amazing. When tunulira mu Uganda, I've been amazed okubanga yegweka nyakalaba.
Okay.
What inspired you to go into this? Because we get our inspirations from other people. What inspired you most?
Okay, first and foremost, I'm a sports person. I am a sports person from childhood, and for most of the people that know me, or my friends, other than outside sport, this is the gym part. I love to work out, and that is my passion. So you find that we people who go to the gym, or the sports people, we get many multiple injuries at different areas and ways. But other than that, even just normal people who do not exercise still get injuries. But the question is, how have these injuries been dealt with? Is the question. So, in my time for travel, I so happen to have foster parents who are therapists. I got to see what other people do in other countries. For example, Spain, where I first saw this kind of work being done. When you go through to Asia, Europe, like US, Canada, people are yearning to have medication that is not medicine. Like treat a body without putting medicine. So for me, that was an inspiration for starters. And also being a sports person, I found that this way of work kind of gives you a more desired result faster. First of all, you have faster pain relief. Secondly, you don't prolong the problem. It is dealt with and there and then, and you're sorted, you go. So it is way faster, but more efficient, yet without medicine. So for me, that was an inspiration, and I ventured into that. Yes.
That's really amazing. When you're sitting, when you're sitting like this, raised, but make sure that you bend them a little. No straight. Kati Musawo, what are some of the most cases you get here?
most cases,
The most common.
the most common. Interestingly, chiri like nange chaja as a shock. First, it is the main lower back. I think tukola emirimu ne tukola tukola nenga we don't speak out for the pains, and we end up being in that pain for so long because we think that that is part of you. Lower back has been most. Shoulder. I want to learn a lot of shoulder pains. Then a single or the neck. That has also been something. So you find that, for example, muntu babazenga alina katukwegamba. If I can give an example, I had one very critical situation where a patient came here, with a client, yalina C1 ne 2 in the structure, C1 and 2 nga zikoze ki zasesetuka nga zinyiga ku nerves eziri responsible for vision, nti kati ye mukulaba nga alina kukola bwati alyokawe ekifo ekyogamba yajja wano netumukolako netumutereeza twamukolako ekituyita cervical contraction n'atereera. Omuntu omulala yajja nga alina pain eno omugongo gwa waggulu nga eyo pain also comes through to the chest forward. Abo bo bangi naye abasinga obungi abalumizibwa ennyo nnyo nnyo be balina lower back. Ate lower back, it's not just lower back alone, ejjiramu pain egitureferringa to as sciatica, nti disiki enyiga the sciatic nerve ne radiating a pain down into the leg up to even the toes, depending on the individual. We have had cases whereby omuntu bamulesa wano nga tayinza nakuyimira straight, oba bw'aba atambula akozesa muggo nga bamukwatiridde naye ng'ava wano ng'atambula, okitegeera. Naye kisingira ddala obukulu nti bwe tuba tumaze mukolako, what we recommend, what to be done after, kyekisinga obukulu kubanga kikibawonyeza ddala. Because my way of doing things, I do not want someone to come here every day, okitegeera. I can work on you once in a month or once and your problem is done and ogenda naye si byakujja wano buli lunaku, okitegeera. So that's how different we work.
So the most cases you get here are the lower back pain.
Call it structure y'omugongo yonna naye nga lower back yo.
Oyogedde ku C1 and 2. Omuntu yenna ali eyo ng'akwegomba alina sooka genda mu ssomero oba asobola okujja wano n'okusomesa?
Nze ekyokusomesa sandikiganye naye nga I might require a license to do that. You get it? Because this is something that is not just done ordinarily. Nange nagenda n'ekisoma, kitegeera. I went and learned. I just didn't come up with a thing and say, okay, Kale, can't you call it just like that? I took time. I went and got my certification in the field. Then you can call it. Kubanga nalyo birina risk. Bw'okikola nga toli well versed with what you're supposed to do, you can cause an injury to someone. Waliwo ebintu by'olaba n'ogamba nti kati kino tekiri mu category yange. For example, I have people who have come here and they have been stroke patients. I don't work on them, reason being, you can do a body manipulation and you trigger what caused the stroke, which together. So I have specialists, a person like Dr. Kakoza. I have a friend called Dr. Kakoza, Adrian. He's a very good physiotherapist, which together. He has specialized in restoration. Akola ku bantu abalina stroke, which together. I have another friend called Dan. Naye is a specialist in moving to gravity, which together. So for me, when a particular condition is not in my category, say forcing a kuanga siri one for money, there's a way we help people. Because if you compare Kati, for example, in a young Korawan, we're comparing a wave. Let me give you an example in Canada. You find that you pay at least $1,000 per session. Okay? Kati wano nojja ne kucharging emitwalo abiri. If you convert that into dollars. What is that? Kitegeera. N'obwemba nkoze eluwerako kubanga nyinza kuwa full body alignment ya mitwalo 2 niyakukola lumbar traction ya mitwalo 25 sijjana mu 5 compared to $1,000 ezolya zaba sasudde. It does not count. You get it? So you find the different things we do. There's not something else we do here called a teller. We use an teller machine. Nanotechnology, not radiations zolaba nga ziri the rays nga kiyamba okujja mu inflammations mu mubiri. You get it? We do such things. So basically ogenda kwesanga nti in terms of pricing we are still very affordable but also reachable. Yes.
Wow, musajja ono ebyaddala aneewuunyisa. He has talked about manipulation, body manipulation. Nzijukira mukwano gwange ina mukwano gwange omu gwakolako ebyaddala. You've said that for you help people. Era omuntu omu yagamba nti life is not measured by duration but it's measured by donation. Obulamu tebabumeasuringa na myaka gy'owangadde ku nsi naye baani b'oyambye. Ebyaddala ono mukwano gwange omugongo gwali gumuluma nga gumuluma nyera yalukomendize nzije gy'oli nga gumuluma nnyo naye bwe yajja n'omukolako body manipulation yatereera. And I want to thank you for that. Webale kutereeza mukwano gwange.
Thank you.
Wow, that's really amazing. Waliwo be bayita ba acupuncture. Bano bo bakuba obuyiso biki. What's the difference between you n'abo bantu?
Well, if you go into the body itself, I'm not talking about acupuncture, but let me just give you a general idea. Tulina surgeons, waliwo dental surgeon, for example. Ye specializing in kuki kumanyo. Surgeon, just not a dentist, but a surgeon. Nti ya specializing a jaw agitegeera okufuufi. Tuwe mugamba nti nafunye injury one, ajja kukola operation n'otereera. Then nodda wali ku orthopedic surgeon ow'amagumba naye nga ye yategeera ekintu kiri ekitegeera. Bonna aba surgeons naye nga bali different. Oleeta heart surgeon naye mulala. So kwegamba the body is still something that is still discovered till today. Ekitegeera. Someone will use acupuncture na treating an injury yawo. Nange nenfuna omulala nenkola adjustment nemutreatinga. Omuntu y'omu n'agenda same injury owa physiotherapist naye ne bakola bye bakola n'amutreatinga n'awona. Does it mean nti waliwo asingako omulala? Okitegeera nti it is a method of treatment. Like I said in the beginning, I do not use medicine. It is your body that I work with to treat it without medication. Yet someone else will say, okay, wano kankukube empiso ejja kukola ki? Kola magic yayo. Nze nekugamba nze empiso sijagala kankole ki? So, in short, that acupuncture has the way it really relieves people with pain. I know it, I can perform a bit of it, but I am not specializing in it. That's why I don't want to go too into it. I even have a dummy here that shows you particular spots where I should touch. Better you don't just pierce anyhow. There are places. Let me give you an example on camera. This is your hand. Did you know that this is here is a trigger point? When I do this, how do you feel when I do this?
I feel
Some pain. Here.
I feel like there is something moving, rotating.
So we have a trigger point here. So when I'm checking, sometimes before I do the manipulation, I can check here to check how you're responding. Now, your trigger point here gives me an understanding. On your knee, there are 4 trigger points here around your knee. I'll give an example. When you go on, hold it out. Ne one of fun at one.
What painful.
At one once. So each area here, its own trigger points. Kyokka olaba sometimes nti abantu bagenda mu massage ne bavaayo nga tebasobola kutambula, ate massage is supposed to relax them. Nti oli ajja kukola massage naye kwata ku trigger points ez'omubiri ezatamanyi n'akozinga another problem. You get it? So you find when I bring you back to the trigger points, kati eyo acupuncture erina, for example, there is an area here that they will pierce, wano, wali, even just one muscle, one muscle. Like we have different areas. I have a whole diagram here where a human being where you show these are the best areas to what? To place the needle and here. You get it? So buli omu alina engeri akikolamu. And also depending on where people live. For example, what I do, most of it, or the styles that I use in treating people, is Malaysian way. You get it? I mix both the Malaysian way of treatment and a little bit of Europe. You get it? Abantu abasinga obungi babayita ba chiropractors. Chiropractors in Europe, if you compare what they do and what the Malaysians do, even kugamba mu local area, there's a whole big difference. But you find that me, I mix the two, because I've been exposed to both of them to get something workable. Njakulaga, like for example, muntu wabeera ne frozen shoulder. In Malaysia, omusajja ajja kukwata omukono guno akwebase wansi, akuturning at an angle, okyusa ensingo, akusike. You get it? Then they pull that hand, you feel like as if it has gone off, there's electricity going, all of a sudden you're like you can't even hold anything. But just within 2 minutes, pain over, then you disappearing. Wow. That is their way. But other people have another way of what? So katwegamba bombuza what acupuncture does, on what physical because the body has gotten, it's not a one size fits all. You get it? It has different ways of, and people are discovering day in, day out. There are people who use water to treat pain. There are people who use air as in terms of sound to treat. So depending on where you have learned from or where the research has been done from, they have their way of treating. Yeah.
Wow. Wow. Simaina wakutandikira naye agambye nti he mixes the Malaysian way and the European way. Bayigo baba bayita ba chiropractor. Era nabo bakola kintu kimu. So what are some of the challenges you face in muguno mulimo gwenda mu passion?
Kati omulimu gwendina mu passion, one of the biggest challenges that people don't understand what I do. Kati oli ajja kujja agamba zinebasera n'ensigo n'enduma mu katono jja kwayo etaano. Money is not the problem, but the question is how are you considering what the person is going to do for you to get healed? Kati jukira waliwo page yange oli agamba I used to see that thing in Chuck Norris ngakati olinafa. Butu, if you hold someone badly or in a wrong way and you twist their neck, you will get that result. You can kill someone. That's the honest truth. But on the other hand, how they say, like for example, when I was young, I was trained Kung Fu. I know exactly how to punch you at a particular point here, and they block some blood from going to your brain, and you'll black out, at least for 10 to 15 minutes. And I'm very good at it. I know I can do it. But I cannot try it on you because if I did it, what happens? So, same applies to that. Until you're trained to do something, but you're with precaution. I can do it with a particular level of strength. At Ejukira, I've already of different age brackets, weight, and all that. Katamanya again to Sakubu. Sigemanyi genda kusa ku mwana wa myaka 10. Sigemanyi genda kusa ku mukadde wa myaka 9 oba 7. Okitegeera. So nti first and foremost I need to assess as an individual the person I'm going to work on and how to work on them depending on the examination I have done before that person, then I do my work. So it's not just jangu katuli omu muchusa kacha. I take a chance in different ways of working on it. You get it? So that is something that you can also think about and then see how to manage.
Because of time, omwami ono tujja mweyongeza naye kasooka tubulire where he is located era nga maaso yeerabawa kubanga ye kaze gwe ndowooza mu Uganda ye yeerabawa. Where are you seeing this industry that you're in?
Like I said during this interview, the body is still being researched on day in, day out. Ojja kwesanga nti n'ekyenkola kirina negative ate kirina positive. Naye nga as a person, what do you base on? You base on the negative or you base on the positive? So okwiraba nga nze, first and foremost, I love my country Uganda. That's the honest truth, because I did this in Canada and I was earning way more to be honest. Nti just session y'omuntu n'akuwa $300. If I compare to here, it's peanuts. Well, you can say the economy is different, yes it is true, but the other people understand the importance of this, that someone will schedule an appointment ngatalina bulumi bwonna naye nga kugamba I need alignment. Okitegeera kubanga amanyi mbadde nkola omubiri gwetaagamu some adjustment najja naye ffe kati mu Uganda challenge eriko oli asooka kufuna pain ayogamba kati ngenzeewa. I have a patient I worked on yangamba yafuna 50 physio sessions in Zambia. Sorry, I had to mention the place. Yafuna 50 physio sessions. Kati simanyi because they are very good physios. Nga Dr. Adrian Uganda is very good. Talking days of 50 sessions now, so you might go and meet a work person, but yali akoze 50 sessions. Now one session yemuteyadda, yet he had 50 before. So the question is, was the person working before doing the right thing over the professional field over there? So you cannot undermine what everyone does. No, we work together. Nti waliwo ebintu ebisinza akola nga bali bakola, waliwo ebyenkola nga takola. But you never know in the nearby future kubanga the internet has opened up for everyone. Nti someone will go and learn all these techniques ajenga muntu omu nga akola buli kimu. Okitegeera. Ate mu ggwanga lyaffe nti our people are also very open-minded. With this having started, I even where I learned from in Malaysia, they called me back and they told me, hey, we have some Ugandans who want to come and learn. Nembagamba, please teach them because being alone, nange netaga kunkolako. And I normally get patients asking, naye kati gwani yakukolako. Ekyo kyekibuuzo. But like I said, this is something that I believe is going to grow beyond. I may have an imagination, but it is beyond me as a person. This is, when we're talking of a human body, it is beyond each one of us. Tulinaba professors who field in terms of medical professors, but they have not been the ones who have finished every problem that is. N'abantu abasoma bajja ne badiscovering ebintu batakola ki, what they didn't discover, and they continue the process. So for me it is an open-ended book. I am here to do my part. Someone else will also come and join. And if there are more of us, the better, because the country, like abantu bangi, you can never be the only person who can do this. So if the more of us, the better. Like, for example, tulina thousands of physiotherapists in the country, but everyone is doing their part. So imagine if we were thousands in this field. Maybe I'm not going to better. It's not one man who can do everything. So for me, that is what I see.
Wow. Ebyaddala ekituufu kiri nti fenna mu industries etulimu twetaagayo omuntu agenda okuba nga atuwonya kati. So whatever you're doing, just to know that there is somebody that can do it better than you, and just give them a platform, just wish them well. Mr. badensaba abantu obabuulire okulera.
Okay, kati saawa zino tuli ku kizimbe bakiyita Colin House, kiri opposite UDCL oba former Umeme Pillington Road wabulwa Workers House. Ekizimbe bakiyita Colin House, room number 82. Yes, wetutuula wetukolera. Esaawa z'okukola Monday, Wednesday, Friday from 8 a.m. to 3 p.m. Tuesday, Thursday, Saturday 8 a.m. to 6. Sundays, unless if someone has paid for in advance. Kati kinagenda ninda abantu mu Uganda yakugamba nzija ku Sunday n'otuula waligayi n'akugamba ha mwana ka program kaze, I'm sorry, naye bataddemu amafuta nojja staff members bazze batudde. You understand? So Sundays only who are paid for in advance, and they are not paying full amount because they pay deposit, because after diagnosis that's when you not cut the wrong and kukola ko full body alignment oba ngenda kola lumbar traction oba ngenda kola ki nano treatment. So at least take a deposit no kakasanti nzija then
abantu bawulidde w'okolera ku Collins House. Do you allow walk-ins or you only about appointments?
No, we do work on both walk-ins and appointments. The difference is here. If you come in as an who has an appointment, we prioritize you. Kati woboze nga appointment yo ya sawa mukaaga ne walk-in najja ku sawa mukaaga, nja kukola ku appointment first because I know this person was scheduled for this time. But of course, as the industry grows, numbers can become much, and then you cannot allow a walk-in. You just say, you know what, we are fully booked for the day. You get it? Because for some of the areas that I have been, you find that your bookings are 6 months ahead. Until you are money from January to June, fully booked on a daily. Unless something has happened, that's when they can reverse, but those things happen. So we are open to both.
Nga tusiibula abantu nyina ekibuuzo kyenjagala okubuuza kubanga nze nva mu nail industry, generally beauty industry. Wetufunamuko kasente, we tend to relax. We nkolayo akaala akalungi nga bampaana, I relax. What keeps you wake up every morning and become, because I'm seeing you already a successful man?
Well, there are many things that lead us to do things that we do. If you do something for the sake of money, the moment you get the money that you wanted, you will relapse. But if you do something with a passion, then we're two different people. It's not about the money that I first said, it's about the passion that I have. Because I have gone through shit before. In 2022, I had a nasty accident, and unfortunately the borderman that was carrying me died on spot. This leg broke. Now, people who saw me during my recovery, like at the gym I work out, I have a gym I work out, it's called Fit Sport in Bukoto, opposite Victoria Hospital. People who know me, who saw me during that time, and the physio guy that I was working with to my recovery can tell you surely, if you don't have a heart to do something, you will remain down. So if I see someone who is in pain and I can help that person change that pain, for me the smile that person comes with of like, it's more than just jangolero, incha, naruli, you understand? Because you'll come for 10 sessions, paying 50,000, whatever 50 is in total. Not just for one session, nekugamba mitwala namwe tano ha. Nenga ku mitwala atano jo sasude mu 10 session. Tofunye kyenkuwadde mu one session. Who is better than?
This one was
So it all depends on your strategy. At times there are people who have asked me now, Rach to take help sessions, according to the way I have been trained, let me do one thing at a time. It's one thing at a time that will take you What leader 1, 2, 3, 4, and you want to grab them at once, you might not do the best as compared to one at a time. So for me, I want when the person comes, focus on the person, work on them. That is my principle.
We are going to implement that even in our industry. Making sure until olwana nnyo okulaba ng'omuntu addayo ne kasmile ako ku face ye. Nga tusiibula omusawo, I want to see your comments down there. Obuuze ky'oyagala. You ask what you want because he's just here. Mu Kampala we nyini oba ng'oyagala kujja to be worked on, just come through. Ye wali enamba ngenda giteekawo awo. I'm going to show you even his account obirenga you follow him up. Thank you so much. Abantu basiibule musawo.
In English. Thank you so much, viewers, for your time, and thank you guys for coming to let the whole facility be known out there because it's important. I really thank you, and we look forward to working with you passionately, by the way, not just for fun, to work on you passionately and to help you get the results that you long for. Yeah.
Thank you so much, sir.
I mean that.
May God bless you.
God is first.
Amen.
Wow.
Kawade kalungi kati gende katesi